Good afternoon. I am Dr. Noel S. Chua. I am a medical oncologist here at the Central Luzon Integrated Oncology Center. So I am here to talk about prostate cancer. So what is prostate cancer? Prostate cancer is a malignancy that develops within the prostate gland. So the prostate gland is a walnut-shaped organ found only in men that secretes your seminal fluid. The seminal fluid in turn is the one that gives nourishment and lubricates the sperm. Risk factors in the development of prostate cancer, number one would be your age. Prostate cancer is rarely found in men younger than 40 years old. However, your chance of having it rapidly rises once you reach the age of 55. It is commonly found in older men 65 and above. Risk factor number two would be your family history. If you have a first-degree relative with prostate cancer, for example, if your father or your brother develops prostate cancer, your chance of having prostate cancer is increased 7 times compared to the general population. Number 3 factor would be your prostatitis. Prostatitis or your inflammation of the prostate gland. Early stage prostate cancer tends to be asymptomatic. However, once it progresses, patient can feel the following signs and symptoms. Number 1, dysuria or painful urination. Number 2, hematuria or the presence of blood in the urine or sometimes in the semen. Patient can also have trouble having an erection or what we call your erectile dysfunction. Patient can also feel frequency or the need to urinate more frequently, especially during nighttime. In some cases, patient can also feel joint pains, either in the chest area, in the back. This is secondary to the prostate cancer already spreading to the bones, which is a common site of metastasis. General guidelines would recommend starting prostate cancer screening at age 55 once it is thoroughly discussed by your physician. It is also recommended to start prostate cancer screening at age 40 to 55 years old if you have the following cases. Number 1, if you have a first-degree relative who developed prostate cancer. So if your father or any of your brothers develop prostate cancer. Number 2, if you have 2 or more extended family members who develop prostate cancer. So aside from your father or your brother, this may be your uncle, your cousin, or your godfather, or your lolos. Removal of your prostate gland and your seminal vesicles following surgery makes it impossible for the sperm to go out of the body and meet the woman's egg for fertilization. Did you know that an 18-year-old Harvard study determined that in men who ejaculated more than 21 times a month reduced the risk of having prostate cancer by as much as 20%. In another study, it was found out that in men who also ejaculated more than 7 times a week reduced their risk to 36%. However, doing it with many partners increases your chance of having STDs or your sexually transmitted disease. And STDs is a factor in developing prostatitis, which in turn is a causative factor in developing prostate cancer. The American Society of Clinical Oncology does not list alcohol intake as a causative factor in acquiring prostate cancer. However, as in all cases, it also has to be taken in moderation. Once the screening test turns out to be positive, we can request a lot of diagnostic procedures to aid us in determining prostate cancer. However, only in doing a prostate biopsy can we have a definitive diagnosis of prostate cancer. If treatment is indicated, then we can offer local treatment like your prostatectomy or your bilateral orchiectomy. This is usually done by our surgeons or urologists. We can also offer radiation therapy. Radiation therapy is the use of high-energy rays to destroy cancer cells. It is usually done by our radiation oncologist. Systemic therapy is the use of medications to combat the disease. These medications can either be in an intravenous route, like your chemotherapy, or an oral route, like your testosterone suppression tablets. These are being prescribed and are being done by your medical oncologist. A wise American statesman by the name of Benjamin Franklin once said, "An ounce of prevention is worth a pound of cure." We may be very busy in this fast-paced world, but always be mindful of what your body is telling you. Remember that cancer is not a death sentence. God is the ultimate healer, and we, your doctors, will always be here for you.